The Ministry of Health and Wellness is stepping up psychosocial support for persons affected by Hurricane Melissa, reaching thousands of residents and healthcare workers across the island. Speaking at the ministry's recent virtual press conference, Chief Medical Officer Dr. Jacqueline Bissessa-McKenzie says more than 500 healthcare workers and over 3,400 members of the public have already received support, and additional teams are being formed to visit high-risk areas.
We're trying to put these psychosocial teams in, for example, community centers or in churches on a regular basis, maybe once a week or once or twice per week, depending on the demand, so that persons will be able to have, for those persons who need more than just that one visit, that they will be able to bring them back over a 3 to 5 week period so that they can get the counseling that they need.
She knows that the ministry is seeking to train more than 3,000 persons to be able to deliver more than 200,000 interactions over the coming months.
Now, in terms of the operationalizing of the mental health psychosocial support, we have trained over 1,250 persons to deliver psychological first aid messages. Our target is to train over 3,000 persons. What it is that we want to do with these 3,000 persons? Our target is over 200,000 interactions for persons in the target areas, in the heavily affected parishes. What is psychological first aid? Psychological first aid will provide the persons that are trained and the persons that they reach with the information that they're able to provide some support for persons where they are.
She emphasized that the initiative aims to equip service providers with essential knowledge and skills to help people overcome challenges effectively.
So for that basic service in terms of treating persons with consideration and with dignity and respect, that can happen at the very basic level. What we expect also is that knowledge will translate into the next step, where it is within communities and within families that kind of support is provided. So persons understand what it is that persons are going through and are able to pick up on certain things that they will be trained on and be trained on what it is that they are to say, so that within the community and within the family we can provide support.